Hello, this is Dr. Chris Robertson providing an overview of Greenhall's diffusion of innovations and providing also some guidance with the SWOT analysis assignment. Greenhall's diffusion of innovations is a model that was introduced in a previous lecture with this week's content. I want to explore it a little bit further because I want you to consider how comprehensive it is when this particular systematic review is written. I believe it was based on, I want to say 300 or 400 or some articles. And so it was a very extensive review of literature that looked at various issues related to implementation, science, and research translation. And so you can see the various components in the model, and I'm going to go through each component one by one and provide some explanation. Let's start with the innovation. This particular model speaks to the need to recognize the innovation with respect to its advantage. Is it effective? Is it cost effective? Is it compatible with the organization's norms, values, perceived needs? How complex is it? Is it simple? Is it manageable? Or if it's complex, is it something that can be done and broken up into pieces and increments so that it makes it more manageable? What is its trialability? Is it something that can be piloted? And with respect to observability, what is the visible benefits that others can see with respect to the innovation or the intervention that you're going to be implementing? Reinvention, can it be adapted? Can it be refined, modified to suit the needs of the practice environment? In this regard, you have to look at the innovation or intervention and consider what are its core elements that lead to the outcomes and what elements are indeed modifiable. And so also considering the risk and the benefits, being able to articulate what are the risks, be it risk to participants, be it risk to the organization, and what are the benefits, again, to the participants, to the organization, to society. It's important to be able to articulate those things. What are task issues to make sure that the components of the intervention or what's being done are things that are actually relevant, that they're feasible, that they're workable, that it's easy to use. Consider the nature of knowledge that is inherent in the intervention. Is it something that can be codified? In other words, can it be classified in a systematic way and transferred from one context to another? And also considering the technical support that may be needed, given this is a component that assimilates more easily. In essence, you're looking at the innovation and giving some thought to whichever of these components may be relevant and applicable, because these are things that are going to facilitate diffusion, also going to facilitate dissemination, and facilitate adoption. And it's not that you'll consider every single one of these elements with respect to your intervention, but you do want to at least go down the list and be able to point out some pros, major pros, a couple of major pros, maybe a major con, but you want to be able to identify the things that are going to facilitate diffusion and things that are going to facilitate adoption and sustainability. And to go back to the model itself, again, looks at these various things: the innovation, the system antecedent, system readiness for innovation, adopter, whatnot, and lays out how these things, how these components and this model interact to facilitate diffusion. Realizing here in the center where you see the innovation and you see diffusion, which is more of an informal process, but you see diffusion, and that is how information or how the innovation is channeled and communicated throughout the organization. And so diffusion, ultimately, you want it to lead to adoption, you want it to lead to assimilation and ultimately dissemination, which is where you're going to take the outcomes and the findings and apply it further than obviously what was done in the project with regard to what are the practice implications, what are we going to do, how are we going to change practice and sustain it, how are we going to change policy and sustain it, what do we need to do with respect to education of healthcare workers in the practice setting or clinical staff in the practice setting, administrative staff in the organization, and also what for the research. So that's the dissemination component. But you want to consider the innovation and these other elements because you want to, where you have the opportunity to create and support elements that facilitate diffusion, those are the strategies that you want to follow and implement. So we went over the innovation. Let's now go look at system antecedents for innovation. So this has to do with the structure, absorptive capacity for new knowledge, and receptive context for change. So when you look at structural determinants, obviously organizations that are large and more mature are more likely to facilitate diffusion and adoption. Those that have functional, differentiated, semi-autonomous departments and units, those that have specializations with the foci professional knowledge, those that have decentralized decision-making processes or structures. And it also mentions those with slack resources to channel into new processes. So these are some structural determinants. When you also look at the absorptive capacity for new knowledge, you've got the pre-existing knowledge and the skills base. What do the clinical staff already know, already have, and also considering not just amongst those staff, but within the organization, and what is their ability to find, interpret, and recodify new knowledge, and also what is their ability to share knowledge with their internal and external networks. And so also speaking to the receptive context for change, you want to look at leadership and their vision, managerial relations. What is the risk-taking climate? Do they have clear goals and priorities? And even with respect to data capture, meaning outcomes, do they have high-quality data capture systems? If there's something that you're going to be monitoring or tracking, do they already look at this? Is this something that they're able to track within the structure that they already have? Moving on to system readiness for innovation, recognizing tension for change. And this is not necessarily a negative thing. This is from the standpoint, or it's an opportunity. So the realization within the practice site that we need to do something different, that there is a problem, we consider it intolerable, and a change is needed. Now, whether they characterize the situation as intolerable or not, at least to recognize that there is a need, that there is a problem, and it warrants change. Looking at, does the innovation or intervention that you're proposing, does it fit the system? This is where you have to again consider values, norms, ask them about their strategic plan. It's important for you to identify how this intervention not only just benefits the patient population per se, but tie it to some of their strategic goals, tie it to their mission, their vision, quality initiatives that they may have in place. It's important because that generates that sense of investment and buy-in and need and fit. Knowing about power balances with regards to supporters versus opponents, who may advocate for you, who may not. Understanding that it's ideal for your supporters to outnumber and be more strategically placed than your opponents. And also assessment of implications. It's important for you to anticipate various implications. And how do you do that? Because you're going to refer back to your literature. And the literature, it will speak to various implications or other anticipations. And so, again, this is how the literature informs you and positions you to be able to speak and share from the perspective of having critiqued and analyzed the evidence. Knowing about dedicated resources, and that does include time, that includes staff, that includes budget, and making sure that there's adequate allocation. I know in some instances projects are done where when the student leaves, there's a question of, well, who's going to continue this? Who's going to take this up? And also looking for monitoring and feedback. In other words, having the capacity, the systems, and the skills to evaluate for outcomes. Another component to this model is the adopter. It's important to understand the individual's needs, motivations, values, goals, skills, their learning style, their social network. One thing when it speaks about adopter here is talking about the individuals within the organization versus the organization itself. So recognizing that adopters fall within various categories. And again, this goes back to Rogers' theory of diffusion of innovation, where it spoke to persons who fall within categories of innovators, those who are early adopters, early majority, late majority, and laggers. You will see this depending on how much of the clinical practice site team you engage with your project. Some people may be very enthusiastic and very supportive, whereas others may not. So it's very important to make sure that you recognize. It's not for you to go in and look at every component in this model and speak to every item under each component, but to recognize those major areas where there may be some concern, particularly where there may be barriers that come up or that are present that will need to be addressed. And so consider this statement. People experiment with innovations, evaluate them, find or fail to find meaning in them, develop positive or negative feelings. They challenge, they worry, they complain about them. They gain experience with them. And ultimately, they modify, work around, or they try to improve or redesign them, often through dialogue with others. This is very important that you understand. Even the person who may be an early majority or a late majority, let's say a late majority, because let's state and consider that perhaps this person has developed a negative feeling, and maybe someone who complains about adding a particular decision aid tool or checklist or using something different in clinic that's a part of your intervention. And so this is where they may modify it themselves with how they may implement, or they may work around it and not do it at all. Or they may try to offer improvements and redesign, either that you may know or may not know about. But again, the dialogue with others speaks to the social networks. And you have to recognize that, because within that social network, there are often areas of influence. And so with the adopters, it's important to understand, am I dealing with a pre-adopter? If a pre-adopter, this is someone who needs to be aware, they need sufficient information, and they need to clearly understand the cost. And this is not just expense, but also consider time. What is it going to cost me? What am I going to have to do? And to know that up front. The early user, they want access to information, and typically they need sufficient training so that they're better positioned to adopt. The established user, they're looking more for adequate feedback, and they're looking for autonomy and support to be able to adapt. And this is why even as you implement and you get to the end of your implementation phase, you want to get feedback from the key players. You want to get some patient experience surveys and some staff experience surveys, because you need to, from an implementation perspective, take their feedback, their perspective, their considerations into consideration with any future changes that are made or any future recommendations. And so looking now at assimilation. Assimilation, this is speaking to the system, and even adopter is speaking to the individual. Assimilation is speaking to the system. In some contexts, the argument can be made that adopter could speak to the overall organization, and I think theoretically it can. And even though assimilation is talking about assimilation by the system, I think the argument can still be made that the assimilation can be applied at an individual level from a theoretical standpoint. However, within the confines of this lecture, assimilation is by the system and adopter is specific to the individual. So with assimilation, we're talking about the team, the department, or the organization, and understanding that assimilation is more of an acclimation, getting to know. And during that process, there are three things that occur: initiation of the innovation, development, and implementation. And these three processes do not occur necessarily in a linear order, and they're surrounded by various shocks, various setbacks, and various surprises. And so it's important to understand that and to anticipate that. Not that everything's just going to fall apart, but to anticipate challenges as things are initiated and as things are developed and as things are implemented. And so that's a part of assimilation, the same sense of we're going to wear these shoes and we got to break them in first. That goes back, if you want to say, to organizational fit. You've got to figure some of those things out. Some things you may be able to modify during that implementation phase. Some things you may not, because you have to go back and get IRB approval. So again, consider that with respect to the system. And so when it comes to assimilation and those challenges and surprises that are anticipated and some unanticipated, what you want to take into consideration is the hardcore with the soft periphery. That's the term that's used. So the hardcore refers to the irreducible elements of the innovation. What are the core elements of the innovation that cannot be changed? And also consider the soft periphery. In other words, what about the organization, the organizational structure, and the systems? What there is required to fully implement these core elements of the innovation? And so when you consider the fit of the hard core and the soft periphery, that's when you can facilitate assimilation at the system level. And so the adaptiveness of the soft periphery is a key attribute that links even back to reinvention and fits as an important feature of system readiness. So is the system ready, and can it assimilate to the hard core elements of the innovation? And so this model is so that when you see things happening, you're able to refer back to, this was in Greenhall's model, his diffusion of innovations model, and it can be explained by blah, blah, blah in that model. Moving on to the implementation process, routinization. So it's not just an issue of implementing it, but if you recall in earlier weeks where it talked about having the evidence-based practice becoming routine. It's so important. That speaks to change, that speaks to sustainability. So you need to consider the organizational structure, the decision making, that can be devolved to frontline teams, leadership and management, advocacy and continued commitment, hands-on approach. Are they actively involved? Are they frequently consulted? What are the human resource issues with respect to staff motivation, capacity, confidence, team-based or individual training, funding? Is that an issue? And it may be an issue all the time, but again, when you look at this model, you're looking to identify major and priority barriers and challenges, not 15, but identify the major ones that are going to impact the system that you're going to be working with, because those are the ones that you want to have strategies to address. And so looking at internal communication, is it effective? External collaboration, what other networks does the organization have with other entities? Again, considering the concept of adaptation and reinvention that was discussed earlier, and feedback, is it accurate? Is it timely? Those are things that facilitate routinization, which is essentially the routine practice. Let's consider the linkages. It's important as a developer that you consider linkage as you're designing and as you're implementing. So during the design stage, which is this semester, as you work with the site and as you work with your project committee, is there shared meaning? Is there shared mission? Is there effective knowledge transfer? Is everyone on the same page? Does the user, meaning the site, have an opportunity to have some contribution towards and some input towards decisions that are made? If you decide or you're thinking, I want to use such and such as a recruitment strategy, but the site tells you, listen, we had a similar project last year, we tried that, it didn't work, you may want to consider something else. So it's very important to make sure that users have that opportunity to provide that input, because again, they're giving you insight that you may not be privy to that will help facilitate diffusion, so that the intervention is channeled through the organization, is channeled through the system, but also that it is adopted and implemented into routine practice. And so when it comes to the implementation stage, again, those linkages that focus on communication and information, user orientation, product augmentation, and technical support. So with whatever is being provided, how may we change it? Can we change it? Or is it a change that would be recommended for future use? And what supports are provided when staff get stuck or not sure what to do or how to handle something? What guidance and support is provided? And also project management support, which is extremely important. So you also need to give thought to the outer context. What is the socio-political climate? Are there policy pushes? If there's a policy push that has just come down, then that may help support the implementation of your project. When you consider some of the things that came down with the Affordable Care Act and meaningful use to some people can be a tremendous burden. However, when you look at the intent of meaningful use and how it was there to help us utilize technology to be more efficient and to obviously capture that we are doing things according to the evidence to promote outcomes, that came from a policy push. And so if someone was doing a DNP project around meaningful use and documenting and capturing meaningful use measures as reflected by practice, that policy push would have been an initiative or support in favor of that particular project. And so it's important when you're reading to see, are there discussions about policies that they say may impact this patient population or this patient problem that you're addressing? Also, when it comes to social and political, you're looking at dedicated available funding streams. That is so important that you recognize that, because again, that goes back to sustainability. You want to be able to tell the site that what you've seen in the literature or what you've read about, because saying I've seen it in the literature may not be their terminology, but what you read about was that this type of funding would be available to sustain this program. Are there incentives and mandates that support a particular goal or particular outcome, particularly if it overlaps with your project outcomes and your project goals? Or is there a requirement that they have according to their funding source, which could be HRSA per se, that they have to meet a certain goal? And does your outcomes and what your project is focused on also meet that goal? When you're also looking at interorganizational norms, norm setting and networks, consider those that are informal. And this is where they compare themselves to other organizations and have other organizations adopted this as a norm. And so that makes me even think about patient-centered medical home, how even among laggards, some laggard organizations who finally got on board to position themselves to be certified or credentialed as a patient-centered medical home, most of them may have done that at a time where it was because it was becoming a norm and they were lagging behind. And also think about quality improvement collaboratives. Again, those are things between organizations where certain norms are set based on networks. And environmental stability is mentioned. The literature that spoke to this indicated that the evidence was sparse and very heterogeneous, and that the impact is small, positive, or not at all. So it's something to take into consideration and likely on a case-by-case basis, but still consider it. And so moving on to communication and influence. Again, when you think about diffusion, diffusion is informal, it's unplanned, occurs through social networks, typically horizontal peers. You have homophily, where adoption is more likely among those with similar backgrounds and socioeconomic status and whatnot. You've also got where you have peer opinion leaders. They provide influence when it comes to diffusion, and this is where hopefully the opinion leaders support your project and you're able to identify who those opinion leaders are. And also with respect to dissemination, which is much more formal and planned, and it occurs more so through vertical hierarchies. And this is where I think we mentioned that concept of marketing. So here marketing is showing up again, where you're increasing the perceived benefit, reducing the perceived cost. You've got not just peer opinion leaders, but you have expert opinion leaders, those that are influencing through their authority and their status. You have your champions at the site, the mavericks, the transformational leaders, the people who can buffer and able to get exceptions in place. So if you need an exception, if typically everyone that comes in goes through this process, but for your project you like to see if a certain percentage could go through a different check-in process or something, whatever, you've got that champion who is able to buffer that for you and facilitate implementation. The boundary spanners, those who have links to organizations and other outside ties, and also change agents, those who explore and empathize with the user's perspective. And these are people who, when you think about people that are serving in the public, how they may have various council members or representatives come and visit a clinic because they want to have that change agent empathize with the users and see the perspective, because that change agent is able to influence policy that will likely influence practice or influence some other component of how services are provided. So, just to kind of recap with the diffusion of innovations model, this model is here so that you understand the various components, and we went through each component and we went through the elements of the components that you need to consider. And so as you work with the organization, and once you get to the point of stating the major barriers or major facilitators, you want to at least be able to identify, again, the major ones. Granted, you may be able to sit here and identify 25, but that is not realistic or feasible for you to do as a part of your project. So identify the main 3 to 5, perhaps, that are priority, that are significant, because those are the ones that you will need to identify implementation strategies for. And so how does the SWOT analysis fit into this? The SWOT analysis gives you the opportunity to evaluate the organization and its environment. It is not by any means a comprehensive analysis. It is the beginning of an analysis. It is the beginning of a conversation. It initiates the level of collaboration and gets the dialogue going in a meaningful way. And so in the SWOT analysis, again, you're going to consider the various components of the model and look at the characteristics of these components and how they interact. And as you talk to the key players, as you talk to an end user or a patient, and as you talk to a clinic provider, and as you talk to an administrator, you will get various perspectives and you will get various insight, and you will begin to see some themes. And through those themes, you can begin to see, I can tell that system readiness is an issue because it emerged when I spoke with this person and this person. And so this is just the beginning, because as you also collaborate with others in the practice setting, there are certain things that will be confirmed and affirmed, and certain things that you may find are not as much of an issue as you may have thought. So again, this may change a little bit over the semester, but it still gives you an opportunity to evaluate and consider, what am I looking at in this environment that may impact implementation, that may impact translation of evidence into practice, that may impact this innovation or this intervention being diffused and ultimately adopted, sustained, and disseminated. And so with the SWOT analysis, you have several questions that are specific to certain categories. And in these categories, you can see you've got the intervention, the resources, institutional characteristics, so on and so forth. Again, it gives you an opportunity to consider some of the main issues that you need to be having conversation with the site about. And these are semi-structured interviews, meaning that you don't necessarily have to ask every single question. You want to make sure that you get basically the gist of it, but you can ask additional questions. So these are to stimulate and facilitate dialogue about these various categories and items. And so you can get insight that will help you make decisions when you find out about and you talk about what you saw in the literature about the resources and the people and the expertise that's needed, and you find out, is it really there from the perspective of the persons that you talk to? That helps shape a decision that you may make with regards to your procedures or your methodology for your intervention based on what you know is or is not available to you. And so once you've done these interviews, you'll go back and identify themes, and then you'll categorize those themes as either strength, a weakness, or an opportunity or threat according to what is listed here. Understand strengths are internal, as are weaknesses, whereas opportunities and threats are external. So you have the descriptions here. And these are, if you want to say starting places, it's not that these are the only way to define strengths, weaknesses, opportunities, and threats, but it gives you an idea. And so as stated in this assignment, the purpose is to identify implementation barriers and facilitators. The facilitators are typically going to be your strengths and your opportunities. Your barriers are going to be your weaknesses and your threats. And so it's also going to help you generate considerations that are going to influence your project methodology. How am I going to do this? This is the intervention I want to do. The literature said they implemented it this way, but I talked to the site and this particular aspect poses a challenge. So I need to see if that's an element that can be modified to better fit and align with the site. Otherwise, you're going to develop a methodology that's not going to be relevant and not going to be applicable, and it's still going to require revision. So it's important to have that conversation and collaboration along the way as you're planning the implementation and also planning how you're going to evaluate if the intervention was effective or not. And again, what you do here will shape your methodology implementation section. Now, there's not a component of this assignment that requires you to reflect on key findings and discrepancies and so on and so forth. However, opportunity will be given for such. I will tell you that a lot of this will show up in choices you make about methodology, and it will show up in some of the things that you indicate in your implementation section. So it's not an activity that you're just doing and there's no additional application. The application is going to be evidenced in your methodology and implementation sections. So this gives you a start and a primer to considerations that you need to look at with developing those sections of the proposal. And so with regards to methodology, some of the areas where it may come up is with regards to the setting. There may be some things with the intervention that you need to adjust, or even the outcomes. With implementation, you may learn something about resources that changes what you initially had in mind, or if you didn't know, it at least helps you to understand what's available to me. If you realize that I need this staff person in this role to do a certain task, I need these types of equipment, and then you're talking to the administrator or the clinic practice person, MD, MP, PA, whomever, and you realize these resources are not here, or they are here, or if there are certain contingencies with using those resources or expectations. Again, it's very important. And also with the anticipated limitations, there may be things that you find that will limit what you can do, something beyond your control. And it also helps you to better identify the strengths of your project itself overall, not the strengths necessarily of the organization, but you're able to reflect upon the anticipated limitations, but also the strengths of your project. And so this concludes the overview with respect to the diffusion of innovation model and the SWOT analysis assignment.